Isang malusog at magandang hapon po sa lahat ng nakatutok sa atin ngayon sa Facebook at sa YouTube pages saan mang bahagi ng bansa. Ako po si Nikki Nesasario, isang Juana mula sa Kagawaran ng Kalusugan at welcome to today's Kapihan with Media. Bago po natin opisyal na umpisahan ng ating talakayan ngayong araw, narito po ang ating mga house rules. To ensure the smooth flow of this session, everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. And number 4, should you have questions, participants shall signify and send them in our chat box. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by the Zoom chat box questions. So paalala lamang din po sa ating mga media partners na naririto ngayon, kung maaari lamang ay mag-stick po sa ating mga topics na i-discuss ng ating mga speakers. At ayan, so ngayon bilang buwan ng Mayo ay Cervical Cancer Awareness Month, we have with us today Dr. Cecilia Liave, Technical Advisor sa Success John Hopkins Program for International Education in Gynecology and Obstetrics or JAPIEGO para talakayin ang status, treatment, and prevention of cervical cancer in the country. Good afternoon, Doc Liave. I believe, Doc, nakamute po sila.
Okay. Good afternoon. Thank you very much po for the honor of and the opportunity to be able to speak to you this afternoon. Thank you very much.
Sige po, Doc. You may take it away from here po. You can start the discussion po.
Okay. So can I share screen?
Yes po, Doc. Sige po. Go ahead.
So can you see now my sharing?
Yes po.
I can go ahead. I just want to see kung it is moving. Oh, there. Can you see my first slide already?
Yes, Doc. Apo.
Okay. So as I was saying a while ago, I'd like to thank the Department of Health and the Kapihan para sa media this afternoon for the honor and the opportunity to be able to speak to you about what everyone should know about cervical cancer. This is our success advocacy. So for this afternoon, I'm going to deal with you with the basics on cervical cancer. What is cervical cancer? I want to show you how a normal and abnormal cervix would look like. What is the etiology of cancer? The continuum, what are the risk factors, signs and symptoms, and the stages of cancer, and what is now the status of the cervical cancer prevention and control in our country. And we'd like to push for the advocacy of the WHO to transition the HPV DNA test linked to treatment. Of course, I'd like to introduce myself. I'm a gynecologic oncologist. In Tagalog, ako po ay specialista sa PEPE. Okay? And for now, we'd like to start with ano ba ang cancer? So, kailangan maintindihan natin, ano ba to? So, cancer is a form of tumor or yung bumubukol, lumalaki. So, ano bang nangyayari? And when you have cancer, what happens is your normal cells will be affected by the cause of the cancer. And for cervical cancer, it's the human papillomavirus. Yung human papillomavirus, when you get it, it becomes, the cells continue to grow. Can I have the previous slide? The cells will grow very, very fast. And when it grows very fast, it becomes abnormal and they multiply. When they multiply, madaming yung cells na yon, nagiging siyang bukol. Pag nagiging siyang bukol, paglaki niya, nagiging siyang invasive, meaning yung mga katabi niyang cells or organs will now be affected by the cancer. Kaya lumalaki siya as a bukol. So, pag naging bukol na siya at cancer na, yun, dun ka na magkakameron ng staging nitong cancer na to. So, we're talking about cervical cancer. So, ang magiging tanong ninyo is, saan ba yun? Ano ba yung cervix, no? So, when you look at the female anatomy, ito po yung anatomy ng babae. Pag nakabuka ka, nakikita mo ang babae ay merong 3 butas. Okay. Una, ang butas mo sa urethra, ito yung ihian. At you have the opening nung iyong vagina na dito naman lumalabas yung menstruation o kaya kung manganganak ka, dito lumalabas ang baby. So you see how powerful a woman is because ang kita mo talaga na itong vagina nito ay bumubuka para magkalabas ang baby. And the third opening ng babae is the anus, yung butas ng dumihan. Kaya nga sinasabi natin yung mga lalaki, 2 opening. Pero tayong babae, 3 opening. So, kaya bionic talaga tayo dahil 3 opening natin eh. Now, kung nakatindig ang babae na diretso, nakaharap, na nakikita yung kanyang pusod, sa ilalim ng pusod na yan ay makikita mo sa area ng hypogastrium, sa ibabaw ng matambok, sa ibabaw ng pepe mo, ay nadun yung iyong matres. Yung matres ay nasa gitna, okay? Dito yon ang bahay ng bata. At yung matres ay continuous to the cervix na malapit sa puwerta o sa vagina. So, ang iyong fallopian tube on both sides at ang iyong ovaries ay narito rin. So, it's important for you to know that. Pag ikaw ay nakatagilid, such that ang pusod mo ay nadito sa harapan, okay? At ang likod mo ng buto mo, ito, ay nasa likuran, ay ang makikita mo anteriorly dito sa katawan mo, sa may puson mo, ay yung iyong bladder, yung puson dito. At anteriorly yan. Then sa likod nun is your uterus na nag-e-end dito sa iyong cervix, dito sa may puwerta, at sa likod nito ay ang iyong rectum na dire-diretso sa anus o yung daanan ng iyong dumi. Bakit ine-explain ko sa inyo itong mabuti? Kasi pag meron kang bukol dito sa kwelyo ng matres, itong bukol na ito'y lalaki at pwede siyang lumaki ng lumaki at mag-ok-ok doon sa iyong bladder such that magdi-develop ka ng butas or fistula doon sa ihian mo. So yung iyong ihi can go to the vagina. So pag late stage na, ito yon ang nangyayari. Or yung iyong bukol sa kwelyo ng matres can go to your rectum, doon sa iyong puwet, sa daanan ng iyong dumi na pwede rin magkabutas. And it can go now, your poo can go now to your vagina. Pag meron kang ganong signs, late na yun. Ibig sabihin, affected na ang bladder mo, affected na ang rectum mo. Kaya, ine-explain ko sa inyong mabuti itong anatomy. Okay? And this is how the picture of the cervix would look like. Dito sa kaliwa is your normal cervix. Nakita mo ang cervix mo sa dulo ng pepe mo ay parang donut, no? Bilog na ganyan, tapos sa gitna may butas. Dito lumalabas ang baby, dito sa butas na yon. Mantakin mo, bionic talaga tayo, napapalabas natin ang baby na 7 pounds dito sa butas na to. And this is another example of your normal cervix. Ito naman ang cervix na after puberty na. Kasi lumaki na eh, no? And if you have a cervix na may abnormality like this, na may polyp, okay? Or pag nilagyan mo ang iyong cervix ng suka, pag may abnormality yan, ay para yang kilawin. Parang yung karne na nilagyan mo ng suka, ayan ay mamumuti. Pag namuti yan na makapal, na nakaangat, baka meron na diyang nagsisimula na lesion na pwedeng maging cancer. So, or kung meron ka nakitang metaplastic cells, benign naman to. Benign itong metaplastic na to, benign reaction. But kung meron kang cancer, makikita mo ng iyong cervix ay parang may nabubulok na karne na. Nakita mo, bukol-bukol. Pag nilagyan mo yan ng suka, namumuti, puting-puti, hemorrhagic, nodular, ito, cancer na to. So, kaya alam namin na ang babaeng pumasok sa emergency room na pagsapasok niya, dinudugo po ako. Pero you know already kasi there's a peculiar smell. May amoy talaga kasi it's like meat na nararaten eh. No. So alam agad namin na yung babaeng yan most likely talaga may cervical cancer. So ano ba itong cervical cancer? Bakit nagkakameron ng ganyan ng mga babae? 99.7% of the time, the cause of the cervical cancer is a virus. Ang tawag dyan, HPV or human papilloma virus. Madaming virus, mga 150 to 200 types of virus sa katawan natin eh. Ito na nga ang tawag dito sa Tagalog ay kulugo. Mantakin mo naman, doktor, ba't naman ako nagkakulugo? Doon pa sa pepe ko. Yung iba sa kamay lang, sa mukha, sa dede. Pero ba't naman ako nagkameron ng kulugo doon sa pepe? At ang masama pa nito ay kung ang kulugong dumapo sa iyo ay the 14 to 15 types na oncogenic. Ito yung kulugo na pwedeng maging cancer. And these are the different types of the kulugo na pwedeng maging cancer. Ito yung type 16, 18, 45. At saka yung others like 31, 33, 35, 52, 48, and so on until 68. So ano ba? Paano ba nangyayari ito? What happens is you have your normal epithelium of your cervix. Ito ang normal. Now, when you develop human papilloma virus infection, which is sexually transmitted, what will happen is you will have an infection. Now, if this infection will continue to persist, when it becomes chronic, and your immunity goes down within 10 to 15 years or even 20 years, this kind of infection can become malignant and can become invasive. Pero yung iba, bago naman siya maging invasive, ay dumadaan sa pre-malignant stage. So what does this mean? It means na bago naman pala ang aking kulugo or infection ay maging cancer, it takes years. And so the doctor has a very long window of time for the doctor to be able to pick you up. Na makikita ng doktor na, ay, meron kang infection sa kulugo. Kailangan gamutin na natin yan. Ay, meron ka na nagsasimulang pre-malignant lesion. Gamutin na natin agad bago pa siya maging cancer. The advantage of treating you na pre-malignant ka lang is that the chances of cure is 100%. So, kailangan maintindihan mo na pwede kang magka-cervical cancer kahit wala kang nararamdaman. So, intindihin mo, ikaw ba ay may risk factors to have cervical cancer? Ano ba yung risk factors? These are the factors na nakita natin na karakteristik ng mga babaeng nagkakamerong cervical cancer. Usually, they have early sexual contact, earlier than 17. They have low resistance, and they have many children, and they have a history of sexually transmitted disease. Kaya iiwasan mo tong risk factors na to. No, what are the signs and symptoms naman para malaman ko na baka mayroon ako nagsisimulang cervical cancer? So, ang problema nga nito is a very quiet disease. No, silent killer nga siya eh. Such that marami sa mga babae na sa pag nagsisimula ang cancer niya, wala pang nararamdaman. Pwede may katiting na spotting, may discharge, may konting pain. Pero hindi niya pinapansin kasi nawawala naman. Okay, no? Pero nakita din natin na yung ibang babae, stage 3 and 4 na, wala pang nararamdaman. Kasi 18% of the women with advanced stage disease of cancer ay wala naman nararamdaman at all. Kaya magigitla ka, aba, ano ba, alam mo ba si Mare, diniagnose ng cervical cancer? Ayan, 1 buwan lang, comatose na. Bakit ganun? Parang ang bilis-bilis naman ng cancer niya. Kasi na-diagnose siya stage 4 dahil wala siyang nararamdaman. So ang mga late signs and symptoms ay yung profuse bleeding, nahihirapan umihi, nahihirapan dumumi, masakit ang puson, masakit ang likod. Usually diagnosed very, very late. Kaya nga sinasabi ng WHO, dapat magpa-screening ka. It should be done every 3 to 5 years kahit wala kang nararamdaman. Kasi nakikita natin na 18% ay pwedeng nasa stage 3. Pinakikita ko sa iyo itong staging. Nakikita mo na pag ang stage 1, dito ka lang sa cervix. Pag stage 2, kumalat ka na doon mga sa tabi-tabi ng cervix mo. Stage 3, umaabot na ang cancer mo hanggang dito sa may buto sa tabi. At stage 4, pwede na siyang kumalat sa bladder at sa rectum mo or outside. Outside, pwedeng nasa baga, pwedeng nasa leeg, no? Ang pinapakita ko dito ay kung ang late stage ka na, ang chances mo to survive pag stage 4 ka is only 7%. Pero kung na-diagnose ka early, na pre-malignant ka lang or stage 0 ka lang or stage 3 ka lang, pag stage 0, 100% ang survival. Pag stage 1, 90 or 86% ang survival. Pero as you go down the stages, yung malala na ang cancer mo, ay bumababa na ang survival rate mo to 36% sa stage 3 at 7% sa stage 4. Kaya mapadiagnose ka agad. Kailangan magpa-screen ka agad. So, but we know, we want to understand, ano ba itong cervical cancer sa Pilipinas? We know that our statistics is very much wanting, but we know that there are about 35 million Filipinas at risk. And these are the women 15 to 65 years old. And we know that cervical cancer is the second most common cancer following the breast. Mantakin mo, mga 7,000 a year ang nadadiagnose, pero 68% ang namamatay, or 4,888 will die on the same year na diagnose sila. Ay bakit naman? It's because they're diagnosed very, very late. 75% of them are already in the late stage when nothing much can be done about it. No? So, paano bang magagawa natin para matulungan niya ang mga babae? They should be screened early. Kaya lang, we still have very few screening facilities, 42%, and 8% are dedicated, and only about 7% have been screened using your VIA, yun yung suka, and your pap smear. And we have only about 10% of the cancer facilities. However, ngayon, nakikita natin na ang daming improvements na nagawa ang Department of Health, and our screening is being increased already, and our cancer facilities dumadami na because of the National Integrated Cancer Control Act and the Universal Healthcare Law. So, yung gap na yan, I think will be improved because we already have the NICA, ito na nga Integrated Cancer Control Act, and the UHC, which I think Dr. Jan will be explaining to you that although we haven't had fully organized the cervical cancer prevention and control, darating na yan because the DOH is already consolidating all the programs that has to be given to access cervical prevention and control. So, ang government have been building the capacity and will do that in the next few years because the goal is that Filipinos will live a long, healthy, and productive life. So, di ba? Ang ganda ng goal. Very nice, di ba? So, and we know that the vision of the WHO is that it will be a world without cervical cancer and it will be eliminated. The goal is only 4 cases of cervical cancer for 100,000 woman years. Itong goal na yun is we are pushing for a 30% reduction in mortality in 2030 by using the magic number 90, 70, 90. 90 of our girls will be fully vaccinated at age 15 years old, and 70% of our women will be screened using your high performance test by age 35 and 45. And all of those who were screened and identified to have the disease will be treated, 90% of them. So that is our goal. And the Department of Health is looking at the continuum wherein our people will be screened, diagnosed, treated, and can even have end-of-life care through supportive and palliative care. Very comprehensive ang plan ng DOH. Then who should be screened? Sino ba yan? So women who are 25 to 65 should be screened. Pag may HIV ka, every 3 years. Kung general population, every 5 years. Kasi ang HIV patient, the number 1 cause of death is cervical cancer. Kaya ang HIV kasi ay has a 6 times chance to develop cervical cancer, 6 times more chance. Kaya kailangan lahat ng HIV patients should have the screening as early as 25 years old. How can your husband help? Maganda na kung ang husband mo will come with you to the doctor para explain kung meron ka ng positive result. So, and may explain din sa husband mo na it's important to refrain from sex at least for 1 month pag ginamot ka. And this is good so that your husband and you can encourage whatever questions you have and address your concerns ng doktor. So, ang kagandahan ng cervical cancer, when you're diagnosed early, you can be cured. At the same time, it can be prevented. Paano ba ma-prevention? There are 3 kinds of prevention. You have primary, secondary, and tertiary. And primary prevention is yung wala ka pang sakit. No? Bata ka pa. At the age of 9 to 14, magpabakuna ng HPV. At may catch-up age ng 15 or more. But ang importante, healthy lifestyle. Kasi ang healthy lifestyle will increase your immunity. Ang secondary prevention is wala ka pang nararamdaman pero i-screen ka na kasi baka may nagsisimula ka ng infection na pwedeng maging cancer. So this will be, the screening will help you. Ang tertiary prevention naman is treatment na yan. Ang piniprevent mo naman yung further complication. Yung screening ay para ba yung warning sa'yo na alam mo na magkakameron ka ng cervical cancer. Parang katulad lang yan ng pregnancy test. Long before you become bumbong, alam mo na mabubumbong ka at mabubuntis ka kasi meron kang screening na pregnancy test. Nasasabihin sa'yo, positive ka. And then the next few months, lalaki na ang tiyan mo. So, ganun ang ibig sabihin ng screening tool or test. So, paano mo ka ba magkakameron ng healthy lifestyle? Of course, you have proper nutrition, exercise, no stress, no smoking, no drinking, and preventive vaccines. And kung pwede, one partner para naman hindi ka mahawa, di ba? So when you talk of screening, ang kagandahan ng screening ngayon, hindi lang ang nag-collect ay yung doktor, nurse, or midwife. So dito sa side na to, nakita nyo na ang babae nakalitotomy o nakabuka ka, lalagyan ng instrumento na speculum, and yung doctor or nurse will put the brush inside the vagina and brush the cervix para makakuha siya ng specimen na ilalagay niya sa specimen bottle na ito, katulad nitong bottle na to, preservative yun. Pero pwede naman ang mag-collect ay ikaw. Ang tawag dito, self-collection. Yun na nga ang maganda dito sa HPV test kasi self-collected yan. So you have the brush. So ang gagawin mo, kahit anong posisyon, nakaupo, takawag dito, nabukaka, no? Na ipapasok mo yung brush sa loob ng iyong vagina, and pag naka-reach na yung brush towards the end of the vagina, near the cervix, ay itutwirl mo yung brush, mga 5 times or 15 seconds, hanggang nakakuha ka ng specimen, at ilalabas mo. Pagkalabas, ilalagay mo dito sa preservative bottle na may liquid, na ititwirl mo yan kahit ilang times, 5 to 15 times, and you close the bottle, at ito ang bibigay mo doon sa iyong doktor or doon sa clinic kung saan ka binigyan nitong collection bottle. So, ang ginagawa nating screening ay it's either VIA, that is putting suka in the cervix, or pap smear, ito na yung binabrush ng doktor, yung iyong cervix, or yung bago ngayon, yung HPV DNA test, which is high performing. Ang VIA is when you put suka into your cervix. Kung ito ang cervix mo, babasain mo ito ng suka. So in 1 minute, you will have a result. Kung maging puti ang cervix mo like this, you can see the whiteness of the cervix, it means meron ka ng lesion dito. So ito yung positive vinegar or positive VIA by just using the suka. Kaya nga, yun dati ang ginagamit natin kasi mura siya. Bibili ka lang ng suka, suka Ilocos, di ba? So this is for your VIA. Ngayon, ang pap smear naman ay yung ang kinukuha ng doktor sa iyo sa loob ng cervix at vagina mo, at nilalagay mo ngayon yung brush na pinakunan mo ng specimen mo dito sa iyong collection bottle. Ito yung pap smear. Yung HPV DNA test parang katulad din ito, pero pwede rin siyang self-collection. At ito, papakita ko sa inyo ngayon kung bakit ang pinipili na ng WHO ay yung HPV testing. It's because from this table, you can see na ang sensitivity and specificity ng HPV testing is really high. At ang difference is hindi wide. Hindi katulad ng VIA 41 to 90. Ang laki, very wide yung range. At ang yung pap smear 38 to 83. Whereas ang HPV testing is 90 to 95 at ang kanyang specificity 80 to 85. That's why the WHO wants to choose the HPV testing kasi very sensitive siya. It's the best test and you can repeat it in 5 or you even nga, yung sabi ng iba, you can repeat it after 10 years. Whereas yung VIA, for 5 years pwede, o yung pap smear 3 to 5 years. So, mas ma-sensitive and specific ang HPV testing mo. Kaya yun ang pinipili ng WHO. Now, pag naging kang positive, anong gagawin? Pag naging kang positive, i-VIA ka muna para ma-decide ng doktor na pwede ko ba itong gamutin ng ablative treatment. Or kailangan i-excise ko pala yon, hindi lang ablation. Dalawang klase ang ablation. Ibig sabihin itong ablation, ito ang treatment na pwedeng gawin mo sa outpatient clinic. It can be yellow or cryotherapy, or it can be heat or thermal ablation. Ang cryotherapy ay kinakabit mo yung iyong cryogun doon sa tangke na mag-help sa iyo maglabas ng ice at ilalagay mo sa cervix where you have the lesion. Nakita mo itong lesion ng cervix mo, lalagay mo ngayon itong cryogun into this cervix at pag ginamot mo, magiging siyang yellow. So pag nagis siyang yellow, it will be like this. Frozen delight ang cervix mo para matunaw siya ng yellow. So that's why after the cryotherapy, maglalabas ito ng maraming tubig, watery discharge, kasi madidefrost or matutunaw itong yellow para mamatay itong pre-malignant lesion. Pag ang lesion mo ay less than 75%, hindi pumapasok sa kanal at hindi pumupunta sa vagina, ay pwede kang mag-cryotherapy at pwede kang mag-thermal ablation. Nakita nila na whether thermal ablation or cryotherapy ang gamitin mo, parehong maganda at parehong nakakagaling ng cancer. 85 to 95%. Ang kagandahan ng thermal ablation, walang nakakabit na tangke na dadalhin, nabibilhin mo pa yung tangke. Kasi rechargeable siya. And ang effect sa cervix is the same, namumuti rin, katulad din ito. However, kung ang lesion mo ay malaki, it goes to the os, it goes to the vaginal wall, ay hindi mo na siya pwedeng ma-ablative treatment, kailangan mo na siyang i-excise. Ang kagandahan nitong lip or LEDs ay meron kang wire na very thin na para siyang knife and it cuts through the cervix and in one swipe, nakukuha mo yung cervix na may lesion so that natanggal mo and then habang tinatanggal mo with this wire knife, it is cauterized. So in one swipe, ang bilis. It cannot be done for pregnant women. Kaya nga as much as possible, ayaw namin munang i-screen ang pregnant women. Kasi ang problema pag nag-positive, nabubuang ngayon yung patient at saka yung doktor kung paano siya ang gagamutin. So it's best that we do it 6 weeks after pregnancy. So ginawan ka ng treatment dahil naging kang positive. So, you should watch out kung meron kang mararamdaman kasi ang check-up mo after 3 weeks kung wala kang nararamdaman pagkagamot sa'yo. Pero kung meron kang naramdaman like fever, foul-smelling discharge, severe cramping, profuse bleeding, then these are warning signals for you to go back to the clinic immediately and be tested whether you have an infection. Or else, kung wala kang nararamdaman, you will be screened after 1 year. After 1 year. Ito, pinapakita ko lang ito sa inyo, napakabilis. Ano yung steps ng 10 steps na gagawin nyo kung kayo ang magkukuha ng iyong HPV test. Of course, the first thing you have to do is to wash your hands. You will be given, pwedeng merong supot na ibibigay sa'yo at brush at saka yung collection bottle. So you will go to the toilet or to the tent or IE room ng doktor. You open the preservative bottle, then you get the brush, then you put it inside your vagina. Pwede kang nakatayo, nakaupo, any position. It will look like this. Pag pinasok mo yung brush sa loob ng vagina, it will end towards the cervix and you twirl it 5 times or 15 seconds and you bring it out. Once na bring out mo na yan, ilalagay mo ngayon sa collection bottle na ititwirl mo para pumunta doon yung cells, doon sa liquid. And sasaraduhan mo, ibabalik mo ngayon sa doktor. Very simple, ang bilis-bilis, di ba? So, ganon ang pagko-collect, no? Ito, just I want to tell you, for our government, we know that naglabas ang PhilHealth na women 25 to 65 will have screening. It's either VIA or pap smear. Para ata yung dalawang yan is nare-refund ng PhilHealth. So dahil nga mahal yung HPV DNA test, so we are just first piloting women 30 to 49 from the general population na gagawa ng HPV test, and those who are older na 50 to 65 will have pap smear. Kasi yung paggagawan mo ng VIA, yung menopause na, wala kang transformation zone. So, sa ngayon, ang ginagawa natin, pag younger, VIA or pap smear, pag 30 to 49, dito na yung HPV DNA test, at pag more than 50, dito na yung pap smear. So we're still awaiting for the national cancer framework before we can decide kung anong i-advise natin sa lahat ng centers. So we know that this is an innovation. Ang goal ng WHO, later we will not be using VIA and cytology. Diretso na tayo sa HPV test. Kaya lang mahal pa siya. Kaya sa ngayon, those na wala pang HPV testing, cytology at VIA muna. Itong test na to can test the following HPV. If you have HPV 16 and 18 and 45, and others. So, para ang result, 4, 16, 18, 45, others, and then negative. So, yun ang magiging result na makikita mo. So, itong HPV test is being piloted in our 30 sites all over the country. Ito ay sponsored by Unit 8, and the implementation is through Expertise France, and ang nag-supervise sa atin is GPIGO, the affiliate of Johns Hopkins University, together with the UICC, and with the support of the WHO, and the support of the National Institute of Health of US, Brazil, Mexico, and Japan. And this is a collaboration between GPIGO and the Department of Health. The success program is being led by the Department of Health. So GPIGO is supporting and helping them implement the program in the 30 sites all over the country. And in these 30 sites, 40,000 ang screened with 5,000 women with HIV. So this is the goal. No? Then after this implementation research, we will be able to extend and to all the health centers or hospitals all over the country. When we have the finished implementation research of this success program, we can be guided by what was learned during that implementation. So remember, cervical cancer can be treated if it is diagnosed early. It can be prevented through vaccination and healthy lifestyle. And screening is very easy and very safe. You can do it yourself. Do not wait for signs and symptoms. So with that, I'd like to end my talk, and I hope I have helped you this afternoon to understand exactly what is cervical cancer, how you get it, what you have to watch out for, and remember, even if wala kang nararamdaman, you're 25 to 65, have a screening immediately. With that, thank you very much and good afternoon. Thank you, Dr. Nikki. Over to you.
Ayan. So maraming salamat po, Doc Liave, sa pagtalakay sa amin kung ano ba talaga ang cervical cancer, ang kasalukuyang kalagayan nito sa ating bansa at kung paano natin ito maiiwasan. So ayan, so makakasama natin ulit si Doc Liave later para sa ating Q&A portion ng ating kapihan for today. At upang ibahagi naman sa atin ang DOH programs para sa cervical cancer, narito si Dr. Jan Llevado, Division Chief ng Cancer Control and Mental Health Divisions sa Department of Health. Good afternoon, Doc Jan.
Hi, Nikki. Hi, Dr. Liave. Good afternoon, ma'am. Ang dami naming natutunan sa presentation.
Yes. Sige po. Doc Jan, you can start to share your slides.
Alright. So, good afternoon again, everybody. No? So, extensively na-discuss na ni Dr. Liave lahat about cervical cancer. Siguro, from the Department of Health perspective, ibibigay din namin sa inyo ano yung mga tulong or assistance namin for cancer patients in general, then later on, we will also touch on dun sa mga primary care programs natin in preventing cervical cancer. Okay, so sinabi kanina ni Dr. Liave about the National Integrated Cancer Control Act na ito talaga yung parang platform natin kung bakit nagkaroon na tayo ng access program for medicines and liver cancer assistance fund. So just a review, no, ito yung objectives natin of the National Integrated Cancer Control Act. So basically, we really wanted to decrease the overall mortality and impact of all adult and childhood cancer, cervical cancer included. So with this presentation, no, let me just focus on three objectives as I will be giving you the Medicines Access Program and the Cancer Assistance Fund na two of the programs na ginagawa namin para suportahan ang ating mga cancer patients. So we should provide timely access to optimal cancer treatment and care for all cancer patients. Why is this very important? So sinabi kanina ni Dr. Liave na dapat maaga pa lang sa screening, matuklasan agad natin na meron tayong pre-malignant lesion or lower stage of cancer para mas mura, no, ang paggamot ng cancer kesa pag late stage na siya, mas matagal, mas expensive, mas matagal gamutin at hindi na tayo sure sa magiging outcome pag late stage of cancer na. Another objective is to make cancer treatment and care more affordable and accessible, kaya meron tayong access program for cancer. And lastly, improve the experience of cancer treatment and care of patients and families. So sa mga access sites natin sa Medicines Access Program, we have our the hospital personnel called patient navigator. So sila po talaga yung tumutulong sa mga pasyente mag-navigate sa health system, where they will go, what diagnostics to get, saan pupunta, para mabigyan ng timely or agaran na treatment ang ating mga cancer patients. Okay, so ito po, this is just parang milestones na Nika, ano na yung mga nagawa natin in the past year. So per article po yan and naka-objective. But for this afternoon, let me focus on the provision of the Cancer Assistance Fund and the provision of medicines through the Medicines Access Program. So we have two support mechanisms for cancer patients. So this is aside from our MAIP, our malasakit programs, no? But basically, ano po yung pinaka dapat nating tandaan is that we have priority cancers for these access programs. So bakit tayo nag-prioritize? Kasi ito po yung mga high burden cancer. High burden meaning ito yung mga maraming kaso ng cancer and mas maagang namamatay ng mga tao. So mas madami ding namamatay sa mga cancer nito. So we have the breast, childhood cancer, gynecologic cancers, which cervical cancer is included, no? Colorectal and other digestive tract cancers, adult blood cancers, head and neck cancer and thyroid, lung cancer, prostate, renal, and urinary. So sinabi ko po kanina, we have two assistants from the Department of Health. Number one is the Cancer and Supportive Palliative Medicines Access Program or ang tinatawag po naming SystemApp. This is really for the support on medicines for cancer treatment and palliative care. So lahat po ng nasa SystemApp is purely medicines. Then the second one is the Cancer Assistance Fund. This will cover diagnostics, therapeutic procedures, and some of the cancer medicines, pag kailangan na po ng hospital o nawalan na po sila ng stock, pwede nilang gamitin yung Cancer Assistance Fund for the medicines. Okay, so let me discuss first, no, yung Cancer Supportive Palliative Medicines Access Program. So yung SystemApp is really a mandate of the NICA law. So Section 23 of Republic Act 11215. So SystemApp is a social protection initiative that caters to the indigent and financially incapacitated population, providing them care, equitable access to the entire cancer care continuum to achieve better health outcomes and to protect them against financial catastrophe. So itong definition po, we need to update this kasi currently, hindi lang po indigent and financially hindi lang po indigent ang tinutulungan natin. So we recognize that cancer is a very financially catastrophic disease. So even po hindi kayo indigent or you're not identified as part of the indigent population of the social services, pwede po kayong mabigyan ng tulong. Then, this is really for free medicines for eligible cancer patients. Eligible meaning po, nandun kayo sa priority cancers natin. Then, yung naka-highlight is very important para sa ating mga kababayan na nanonood ngayon. Valid clinical or medical abstract lang po and valid prescription or treatment protocol. So, dalawa lang po talaga yung hinihingi namin. Abstract and treatment protocol. Okay, so ito po yung listahan ng mga gamot na kasama sa Medicines Access Program. So, uulitin ko po, hindi lahat ng gamot ng cancer ay nandito. Itong mga gamot po na nandito ay nasa Philippine National Formulary natin at inapprove po ng Health Technology Assessment Council pursuant to the Universal Healthcare Law. So, hindi po kasi makabili ang gobyerno ng mga gamot na hindi nakalista sa Philippine National Formulary. Mayroon po kasing mga nanghihingi sa amin ng gamot ng mga innovative medicines which is really not included in our medicines portfolio. So, kaya po naka-highlight dito, all medicines are within the Philippine National Formulary and all new medicines, pag may mga bagong medicines po tayo for cancer, dapat po may positive HTAC recommendation. Okay, so ito po, gusto ko lang pong ipakita sa inyo ang cancer control budget for medicines for the past years. So actually, nag-umpisa ang Medicines Access Program 2014 pa pero nag-umpisa siya sa breast and childhood cancer. But come 2018, from almost 200 million, umaakyat po tayo in 2021, naging 500 plus ay 700 million. Ngayong 2023 po, meron po tayong budget na 1.57 billion pesos for the Medicines Access Program. But considering po na ang incidence ng cancer cases in the Philippines ay umaabot ng more than 150,000, actually in reality po, 20% lang ang nabibigyan talaga natin ng assistance to cancer. Ito po yung mga enrolled cases natin sa mga hospitals. Okay, so paano po ba maka-access ng medicines sa Systemap program ng Department of Health, no? So, meron po tayong tinatawag ng mga access sites. Mamaya po, ipapakita ko sa inyo kung ano-anong mga ospital ang access sites. But before that, ipakita ko lang po sa inyo ang process flow, no? How to access. So, pag ang diagnosed po, ibig sabihin na diagnosed na kayo ng cancer patient, magsisik kayo ng treatment sa ating mga hospitals. Ang una niyo pong makikita doon ay yung tinatawag nating patient navigator. So, ang patient navigator, i-determine po niya kung qualified kayo to avail for the Medicines Access Program. So, ang availment or ang eligibility lang talaga is dapat yung mga medicines or yung mga gamot ay kasama sa 8 focus cancers na pinakita ko po kanina. So, kung eligible po kayo, kung hindi po kayo eligible, i-refer po kayo sa Malasakit Center and other platforms. So, nandun po yung MAIP, yung Malasakit, PCSO, and all others. Pero kung eligible po kayo, enroll kayo ng patient navigator natin in the Systemap Information System and you are entitled to free medicine. So, ang kagandahan po pag na-enroll kayo sa Medicines Access Program natin, you are assured of all your medicines for the entire cycle. So usually, nagtitake ang cycle, ang chemotherapy cycles ng mga 6 to 8 months. So assured kayo po sa medicines na yun. So lastly, you will be recorded in the patient registry. So very important is enrollment of patients. So dapat po enroll kayo doon sa access site kung saan kayo magpapagamot. Kasi marami din tayong mga kababayan na pumupunta sa opisina namin na nagre-request lang ng gamot. So for example, ito yung mga charity patients ng mga private hospitals. So for example, Medical City or St. Luke's or other hospitals na hindi access sites natin. So binibigyan pa rin po natin sila ng medicines hinahanapan namin sila ng mga ospital kung saan sila pwedeng makakuha ng medicines. Pero hindi po assured na sa buong cycle nila, mabibigyan talaga sila ng medicines kasi nakabase talaga sila sa buffer ng medicines within the hospital. So it's very important po if you wanted to avail the entire medicines access program to complete your chemotherapeutic cycles, kailangan po sa access sites po kayo magpatingin and magpagamot. Okay, so sinabi ko na po yung reasons for non-enrollment. So non-enrollment, ibig sabihin, galing ka sa ibang hospital, private hospital, or a hospital that is not our access site, tapos ayaw mong matransfer sa mga DOH hospitals natin, or perhaps your physicians does not allow you to transfer your treatment, no, and other special requests or endorsements. However, or nonetheless po, kahit mag-request kayo, pwede pa rin po namin kayong bigyan ng gamot as long as may available na gamot yung access site na makikita namin, you can still request for free cancer medicine. So, but it is really subject to the availability of the medicine. Siyempre po, uunahin natin yung mga naka-enroll doon sa access site. So, for those patients or families of our patients who wanted to avail our medicines, no, not in our access sites, you may still contact us through DPCB SCD map at doh.gov.ph. Okay, so yun po yung Medicines Access Program. Yung second assistance natin na binibigay sa mga cancer patients ay yung Cancer Assistance Fund. So, special provision po ito sa ating GAA, no, simula nung, I think, 2021, and discovers diagnostics, therapeutic procedures, and cancer medicines not accommodated in the system map. Pero tatandaan pa rin po natin na meron pa rin tayong priority cancer, yung 8 ko pong sinabi kanina. Okay, so ano naman po ang Cancer Assistance Fund? This is really mandated again of the National Integrated Cancer Control Act to support the cancer medicine and treatment assistance program. Tapos, ang isang mandate din po is galing sa ating General Appropriations Act, Special Provision Number 13, to fund the cost of cancer treatment and its care-related components, including needing diagnostics and laboratory. So, we recognize po na hindi lang medicines ang kailangan ng ating mga patients. So, kailangan din po nila ng support sa diagnostics kasi usually, yung iba, sini-CT scan every 6 months to check kung lumiliit ba yung bukol and ibang mga therapeutic procedures like surgery or radiotherapy and whatnot. Ang Cancer Assistance Fund po ay can cover outpatient and inpatient services, and same pa rin po yung requirements, medical abstract, and treatment protocol. Okay, so ito po, pinapakitang ko lang po dito yung budget natin for the Cancer Assistance Fund. In 2022, we were given 529 million through special provision of the GAA. In 2023, we were given 500 million. But please note po na ang ating Cancer Assistance Fund ay maximum na binibigay po namin ay 150,000. So, per patient per year, 150,000. So, ang makikater natin out of the 15,000 enrolled in our information system is 3,000, at least 3,000 cancer patients. So, that's 20% of our enrolled patients in our access sites. Okay, kasi kung bibigyan talaga natin lahat ng pasyente, no, sa 150,000, aabutin tayo sa budget na 2.7 billion if all of our patients are accessed. So, that is the prerogative na po of our legislators, but we're really pushing for universal coverage for the Cancer Assistance Fund. Okay, so ito po yung mga listahan kung ano ang kasama sa Cancer Assistance Fund. So, essential medicines, therapeutic procedures, diagnostics. So, actually lahat po, as long as diagnosed cancer patient ka. Pero kung hindi ka pa po diagnosed cancer patient and ida-diagnose ka pa lang, unfortunately, hindi siya covered ng Cancer Assistance Fund. Yan po yung provision na gusto namin ipaglaban sa ating mga legislators to include high-risk individuals. Okay. So how do you avail of the Cancer Assistance Fund? So kung kanina, meron tayong mga patient navigators, ngayon naman po, for the Cancer Assistance Fund, papasok po ito sa Social Services Department ng hospital. So, halimbawa, if you're already a patient of the hospital, pupunta ka sa hospital, no? Then, pwedeng galing sa outpatient, pwedeng galing inpatient, pero ang una mo talagang point of contact is yung Social Services Department to assess your eligibility and to process the request. Tapos, kung hindi ka po eligible, i-refer ka po ng patient navigator or ng social services to other hospital funding support. So, yung sinabi ko po kanina, kung may mga MAIP, yung mga PCSO or other, for example, in Eastern Visayas, they have the Tingog party list within the hospitals. Nire-refer po doon yung pasyente. But if you're eligible, you can avail of the cancer services, and the Social Services Department submits to us the fund utilization report. So kung eligible ka po, kahit anong diagnostics or treatment procedures, pwede pong i-avail as long as you are a diagnosed cancer patient. Again, enrollment of patient is very important. So, usually naman yung nag-a-avail ng Cancer Assistance Fund natin ay mga patients din natin sa Medicines Access Program na kailangan ng other diagnostics or treatment procedures. So, they are already enrolled once they have availed of the Medicines Access Program. So, ito po yung very important. Ano-ano po, saan po kayo pupunta pag tingin niyo po may cancer po kayo or kailangan niyo pong i-refer to a DOH facility or to a hospital or to an access site from a private institution. So in Region 1, Ilocos, we have Region 1 Medical Center, Ilocos Training and Regional Medical Center, and Mariano Marcos Hospital and Medical Center. In Region 2, we have, sorry, nawala yung Region 2 dito, but it's Cagayan Valley Medical Center. But for 2023, we have certified Region 2 Trauma Medical Center to be included in our access sites to cater not just the population of Region 2, but actually to the borders also of the Cordillera Administrative Region. For Carpo, we have Baguio General Hospital and Medical Center. For Region 3, we have Dr. Jose Bivina Memorial Medical Center. Bataan General Hospital, we have Paulino J. Garcia Memorial Research and Medical Center. For Region 4A, we have Batangas Medical Center, but unfortunately for Region 4B, wala pa po tayong certified hospital doon as an access site kasi wala pa sila talagang hospital na level 3 facility that can give or that can cater to cancer patients. For Metro Manila, we have a lot. Amang Rodriguez, East Avenue, Jose Reyes, Rizal Medical Center, Philippine General Hospital, National Kidney and Transplant Institute, Philippine Children's Medical Center, National Children's Hospital, and Asian Hospital and Medical Center. For Region 5, we have the Bicol Regional Training and Teaching Hospital and Bicol Medical Center. In the Visayas, we have Western Visayas, Corazon Locsin, Montelibano, and Angel Salazar Memorial General Hospital in West Visayas. Angel Salazar is a local government unit-owned hospital in Region 6. Then in Region 7, we have Vicente Soto Memorial Medical Center, and for Region 8, we have Eastern Visayas Medical Center. In Mindanao, we have Zamboanga City Medical Center in Region 9. We have Cotabato Sanitarium and BARM. But we added we have certified another access site for BARM. Amay Pakpak Medical Center is part of the CAF access site in 2023. Then Region 12, or Soxargen, we have the Cotabato Regional and Medical Center, Northern Mindanao Medical Center for Region 10, and Davao Regional Medical Center and Southern Philippines Medical Center in Region 11. So, ito pong mga binanggit ko, these are the access sites. They have the funds, they have the medicines, they have the services, and they have the capacity to cater to our cancer patients. Okay, so nasabi ko na po kanina, we are adding Region 2 Trauma and Medical Center in Region 2 and a May Pakpak Medical Center in BARM. But we are also adding Lung Center of the Philippines and Tondo Medical Center as part of our access sites. But for 2023 po, Cancer Assistance Fund lang po ang maibibigay namin sa kanila kasi po na-allocate na namin yung medicines access for the 31 access sites. But they can use the Cancer Assistance Fund money to buy the medicines for chemotherapy and palliation. Okay. Very important, spending everything in cancer treatment might not be strategic. So, gusto ko yung sinabi kanina ni Dr. Yave na dapat talaga prevention and screening kasi dun natin makikita and dun natin maaagapan ang paglala ng cancer. At lalo na ang cervical cancer na pinag-uusapan natin ngayon. So, ito, focusing on prevention and early detection is key. Okay? So, aside from the Medicines Access Program and the Cancer Assistance Fund, very important ang improvement of vaccination services sa cancer. So, alam niyo ba na ang cancer, maliban sa healthy lifestyle, ay maiiwasan din, kaya ako nilagay, pag-iwas sa cancer. Maiiwasan ng cancer sa pamamagitan ng pagbabakuna. For example, hepatitis B vaccination. So, ito po ay binibigay sa mga bagong pinanganak ng mga bata, less than 24 hours after birth. Binibigyan po natin sila ng hepatitis B dose because this is very important to prevent liver cancer. Ang isang sinabi kanina ni Ma'am, ni Dr. Yave, human papilloma virus vaccination to prevent cervical cancer. Why? Because ang pinaka-cause talaga ng cervical cancer is the human papilloma virus. So yung sinabi kanina ni Ma'am, no, na HPV 16 and 18 and others, yung madaming number. So yan po yung piniprevent natin for cervical cancer is the human papilloma virus. So kung makikita nyo po, nag-start tayo ng HPV vaccination simula 2015 hanggang 2021. Medyo mababa talaga ang coverage natin for HPV vaccination. So ang target population natin for vaccination ng HPV ay 9 to 14 years old. So dapat talaga before sexual debut, yung tinatawag natin, before sila mag-sex, dapat nabakunahan sila ng human papilloma virus. Okay, so another important is to expand screening and early detection services. So for hepatitis B, which is a very important cause of liver cancer, is the hepatitis B screening for mothers. So pag buntis ka po at pumunta ka sa health center natin, dapat talaga merong hepatitis B screening ang mga pregnant women kasi dapat nating malaman o dapat ma-prevent din natin ang mother-to-child transmission ng hepatitis B kasi naipapasa siya sa babies natin. So kailangan talagang magpa-screen and to be treated if found positive. So, ito yung binabanggit kanina ni Dr. Yave. This is a new project. Si Dr. Yave po ang aming technical specialist or advisor for the success project. This is in partnership with GPIGO. So, ang tawag ko dito is maagang pagtuklas. So, because very important talaga ang screening at saka ang early detection. So, ang sinasabi ni Ma'am kanina, this is really self-collection. This is very comfortable for us women, no? Kasi hindi mo na kailangan bumukha ka in front of somebody. You can do the self-collection of the specimen in your cervix. Padali lang talaga, then it will be submitted for testing na, no? So this is really a high-performance test. Sinabi kanina ni Ma'am, mataas ang sensitivity and specificity. And ang maganda dito, pag nag-positive ka, gagamutin ka talaga nila agad. Okay, we are currently pilot testing this in 30 sites nationwide. And ito po yung na-screen namin as of May 19, 2023. So out of the 25,000 screened, meron pong nag-positive na 2,360. That is 9%. Matakas po ito ha, 9% of those screened. And yung na-triage po is 816, so that's 35% of 2,360. And yung naka-receive ng treatment ay 517. So, ito medyo mababa pa yung na-triage and na yung na-receive ng treatment. Ito yung ginagawa namin ng paraan ngayon na dapat yung mga nag-positive ay ma-recall namin for triage and treatment. But nonetheless, ang gusto ko lang ipakita dito na mataas po ang 9% na positivity rate for HPV, no, of those screened. So, very important talaga na magpa-screen tayo, no, especially that pag tumatanda, we are really sexually active. So, dapat we can be screened at least every 5 years. And if you are HIV positive, dapat at least every 3 years. So, ito po yung mga sites natin for the success project. Unfortunately, not all regions have kasi po, this is a demo project. So, inaantay namin yung implementation research na ginagawa ni Dr. Yave para maibigay namin sa Health Technology Assessment Council. So, once we have positive recommendations from the HTAC, then we can buy the HPV DNA kits. Ngayon po kasi ang ginagamit natin HPV DNA kits for testing are donated from Jepaigo. Okay, so lastly po, maliban sa cervical cancer, sa mga ganitong age, dapat talaga early detection din ng breast cancer. So, kaakibat ng cervical cancer ang breast cancer. Kasi, bakit? Very nagagamot ang breast cancer kung maaga ka talagang nalaman na may bukol. So kung may bukol ka, dapat ka talagang magpatingin and at least every month dapat may salat sa suso tayo, no? Or kahit every birthday nyo, dapat meron talagang breast self-examination. So I think, Nikki, this is my last slide. Maraming salamat po sa inyo.
Ayan. So maraming salamat po, Doc Jan. Nakita natin sa naging discussion ni Doc Jan, no, yung iba't ibang naisulong natin para sa cancer. Nariyan yung assistance natin para sa mga gamot at treatment sa pamamagitan din ng ating Cancer Assistance Fund. So ayan, no, lagi po nating tatandaan na mayroong kagawaran ng kalusugan na handang umagapay sa ating mga pangangailangang pangkalusugan. So mga Doc, nandito na po tayo sa ating Q&A portion for today. So, hindi na rin po natin patatagalin pa, no? So, para po sa ating first question, people say that cervical cancer commonly occurs among older women. Is it possible po ba for younger women na magkaroon din ng cervical cancer? Doc Liaven, Doc Jan, to answer po.
Sige, actually, very possible. As long as you are a sexually active individual, it is possible that you will be infected by human papilloma virus, which is really a cause of cervical cancer. Kaya po, sa HPV vaccination natin, kahit sa private sector, nagbibigay sila ng HPV vaccination sa mga older women, older population. Sa government po, ang ating principle is really before sexual debut. So that is 9 to 14 years old kasi bago pa sila makipag-sex, no, dapat may bakuna na talaga sila against HPV infection. Nikki, you're muted.
Thank you, Doc Jan. Thank you din po sa answer. Doc Liave, would you like to add something po sa answer ni Doc Jan? I think,
Hello?
ayan.
Sorry,
Sige po.
there's something wrong. Hindi ko ma-unmute. Okay. What was the question again?
Ang question po, Doc, ay people say that madalas po ang cervical cancer ay nangyayari sa mga older women. Possible din po ba ang magkaroon ng cervical cancer ang mas bata?
Yes. Posible na mas bata, pwedeng mas bata. Actually, the youngest patient that I know was from the Philippine General Hospital when I was a resident. Our patient is 13 years old. I mean, she's a pedophile. At a very young age, meron talaga siyang sexual contact. And she was brought in by the police to the Philippine General Hospital. Initially, we were thinking that maybe she's just having a very huge kulugo or what. But it turned out to be positive for cancer. So you can have cervical cancer even if you're very young. And nowadays, we're seeing even more younger women having cervical cancer. And from the successful program, Ma'am Jan, ang dami na nating napipick up na mga 20 years old, 30 years old from the HPV DNA positive patients na pag-examine namin after they were found to be positive, some of them already have the cervical cancer. Kaya madami na rin napipick up. Wala pa lang kami ng total number, but it's true, as long as you are sexually active kahit bata ka pa, pwede ka rin magkameron ng cervical cancer.
Thank you for that answer, Doc Yave. No, to clarify po, no, what you've mentioned, the 13-year-old was a victim po.
Oh, yes, was a
Yes.
victim.
Apo. Sige, with regard po dun sa answer ni Doc Jan kanina dun sa question, no, kahit po ba 14-year-old or 15-year-old above na, pwede pa rin po magpabakuna ng HPV, kontra HPV, and ilang booster shots po ba yung kailangan nito afterwards? At Doc, available din po ba ito sa ating mga DOH centers?
This is a good. Sige, so for us, Nikki, no, sa government, kasi syempre limited budget tayo, may target population lang talaga tayo. So sinabi ko kanina, mas bata, 9 to 14 years old before sexual debut. Actually, in the next years, kailangan namin pag-usapan with the experts if magkakaroon tayo ng single age cohort ba, ibig sabihin 9 years old lang ba para ma-cover lahat, or multi-age, ibig sabihin yung 9, 10, 11, 12, 13, 14. Pero pag ganun kasi, mas mahal yun. So, mas maigi siguro single age, tapos kada young girl na magda 9 years old, pagka 9 years old niya, babakunahan natin. So, ganun yun. Sa ngayon, 2 dose tayo with a 6 months interval. Pero wala tayong 3rd dose. I think, ma'am, correct me if I'm wrong, baka sa adult may 3rd dose, hindi po ako sure. Pero sa children, 2 dose po tayo.
Yung sinasabi ni Ma'am, mayroon ang WHO noted that it's best to give at 9 to 14 kasi this is the age where your immunity is very high. Kaya binibigay nila na best at 9 to 14. And yung pong bakuna is prophylactic. So it's best be given bago ka mag-sexual contact. Di kaya binibigyan nila ng 9 to 14 kasi usually ang YAPS ata, ang first contact natin is 15 or even earlier. So kaya choose yung 9 to 14. Then yung 9 to 14, through the experiment, yun ang highest ang immunity na nakukuha. Kaya it's best be given at 9 to 14. Pero kung gusto naman ng pasyente na magpabakuna, then it's okay. You will also be protected even if you're older, if you're more than 15 years old. Ano nga I have a patient who is 60 years old. Medyo showbiz siya. Sabi niya, ano ka ba, doktora? Bigyan mo ako niyan. Kasi sexually active ako, tsaka may bago akong boyfriend ngayon. So, sabi ko, ay out of label yan pag ganyang age ang study hanggang 45. Di off label. But what can you do? It's being asked by the patient. And so, sabi ko, di, bibigyan kita niyan, pero pipirma ka. So, parang, hindi ko malaman, Dr. Jan, you cannot just say no. You cannot say no, di ba? So, I have to give her, but she has to sign na off-label yung pagbigay ko sa iyo ng bakuna. O tingnan mo, kahit sino nag-aas. Di
Ako,
ba?
ako ma'am, I had mine 24. Oo.
Very good. Kasi mapoprotect ka talaga eh. It's very good na mapoprotect ka.
Ayan. So maraming salamat po Doc Jan and Doc Yavi for clarifying that po, no. So para po sa ating mga magulang, ating mga legal guardians, no, advised po na ang HPV na bakuna ay maibigay sa ating kabataan sa edad na 9 to 14. Ngunit kahit naman po lumampas sa edad na yun ay maaari pa rin po magpabakuna upang manatiling protektado. Ayan. So para naman po sa ating next question, no. At what age, I think natalakay na rin po ito sa ating mga discussions earlier, pero to reiterate and to clarify din po sa ating mga tagapanood for today, at what age po dapat nagsa-start magpa-screen para sa cervical cancer? Gaano po ka-regular ang testing na kailangan gawin? May certain activities po ba or symptoms na trigger para agarang magpa-test? And for Doc Jan, no, saan po maaaring makakuha ng self-screening test and meron po bang libreng bigay ang DOH? Sige po, Doc Liave and Doc Jan to answer.
Okay, so I will start first. No? Ang ating recommendation ngayon through the PhilHealth, correct me if I'm wrong, Dr. Jana, we know that we start the screening at 25 and then we end at 55. Pero parang I heard that they might increase ito at 65. Dati kasi 21 years old, as early as 21. Pero binago na yung ruling na 25 to 55. Ini-screen natin VIA and pap smear. For now, dahil nagpa-piloting tayo, 30 to 49 from the general population, tayo nag-HPV DNA, at saka 25 to 49 for women with HIV. So kahit wala ka nararamdaman, screen ka na 25, especially if you're sexually active. Kahit nga yung mga virgins, pag they reach the age of 30, pinapa-test ko na rin eh. Kasi you don't need sexual penetration in order to get the disease. Pwedeng fingering lang din. Or kahit, it is liquid to liquid kung kunalingus yun. O, diba? Pwede ka pa rin magkameron. So, kaya kahit virgin, pag 30 and above, ini-screen na rin namin. Okay. May nakalimutan ba ako si Dr. Jan?
Wala naman, ma'am. Yung sites natin, ma'am.
Sites natin. Nakalista yung mga sites na binigay ni ma'am, na lista kanina, nakalista. That's all over the country. Yeah. You can go there, free yung HPV DNA test. Mantakin mo, ang mahal niyan, 7,000 to 8,000 sa St. Luke's or sa Asian. Dagdag mo pa kung i-examinin ka ng doktor, aabutin ka siguro ng mga 9,000 to 10,000 eh. I was joking nga but can I be screened? Sabi, ma'am, lampas ka ng 49, di ka na pwede. Kaya hindi ako pwede mas-screen. Ihintayin ko na lang yung libreng screen sa older women. Okay. Ano pa, ma'am? Sa tanong.
Yeah, I think covered naman na po yung answer ng question po, Doc Liave. Doc Jan, would you like to add something po or okay na po yung answer ni Doc Liave?
Okay na si ma'am. Siguro inaantay lang natin talaga yung age staff recommendation para we can roll it in a national scale. Kasi maganda talaga siyang screening method, no? So we're waiting for that.
Ayan. So maraming salamat po, Doc Liave and Doc Jan. Konting questions na lang po for today. Para naman po sa ating next question, no, maaari po bang maging dahilan ng cervical cancer ang pagkakaroon ng irregular na menstruation at pati na rin po yung pagkakaroon ng polycystic ovarian syndrome? Maaari din po ba siyang maging cause ng cervical cancer? Doc Liave and Doc Jan po to answer.
Ang polycystic ovary ay hindi nakakakos ng cervical cancer. Yan ay hormonal problem yan, yung polycystic ovary. Kaya do not be worried na pag may polycystic ovary ka, ay pwede maging cancer. Pero kasi ang problema niya ng PCO, that's hormonal, it can be chronic. Pwedeng ang tagal siya, yung hindi siya ang hirap gamutin. Parang gano'n. Kaya ang iniisip mo baka mamaya cancer na. Hindi yun totoo na magiging cancer yon. If you have bleeding, hindi ibig sabihin cancer agad yun. Kaya lang kasi, ang unang sign ng cancer is spotting dugo. Kaya pag gano'n, pa-check mo na kahit spotting lang yun, baka meron ka ng lesion doon. Yung iba nga, hindi naman, wala man lang spotting meron na palang cancer. Maraming ganon.
Ayan. So maraming salamat po, Doc Yavi, for clarifying that po, no? And for our last question, I believe in this is for Doc Jan. And I know na i-discuss na rin po ito sa presentation kanina, but to reiterate and to clarify po to our viewers, paano po maa-avail at saan po dapat magpunta para sa ating cancer assistance?
Ayun. So, yung pinakita ko kanina, Nikki, yung 31 access sites, plus we have 4 for 2023, no? So, in total, 35 for the Cancer Assistance Fund. Doon po sila pupunta talaga dapat. So, ang sinabi ko kanina, dapat enroll sila to be assured for the medicines for the entire cycle. And of course, to avail yung Cancer Assistance Fund natin that covers diagnostics, treatment procedures, and other care for the cancer patient. So I will share naman the slides so they can see the 35 access sites.
Ayan. So maraming salamat po, Doc Jan and Doc Yavi, for sharing your time and your knowledge to us. And bago po natin ang opisyal na tapusin ng ating kapihan for today, muli po, Doc Yavi and Doc Jan, for your takeaway messages po sa ating mga tagapanood.
Ang takeaway message natin is very important that you are screened even if wala kang signs and symptoms. And in order to save women's lives, I think number 1 is healthy living, then vaccination, early screening kahit wala pang nararamdaman, and early diagnosis and treatment can save lives of our women. The nice thing about it is cervical cancer is treatable when diagnosed early. It is very, very preventable. So have yourself screened now.
Ayan. Maraming salamat po, Doc Yavi. Doc Jan, for your takeaway messages po.
Ako naman on top sa sinabi ni Ma'am. So kung ang mga kababaihan natin pumupunta sa isang health center natin, no, for other services, isama nyo na yung pagtanong about cervical cancer screening and even to have clinical breast examination kasi sabi nga ni Ma, dapat talaga very important na maaga natin ma-detect itong mga sakit nito. And secondly, siguro, do not be afraid of vaccination kasi marami na tayong, it has been there for how many years already it has been tested, not just HPV vaccination, but even COVID, no, lahat tayo nagpabakuna, okay naman tayo, diba? So, wag po kayong matakot. I am reiterating na very important yung hepatitis B vaccination natin sa mga babies and yung human papillomavirus vaccination natin sa mga 9 to 14 years old na ginagawa natin sa ating mga schools. So that's very important po. So I hope the parents will give their consent and kung may pag-aagam-agam po sila, narito po ang Department of Health and even our service providers in the health center to explain about the vaccine and to explain to them what the procedures are. Thank you, Nikki.
Ayan. So muli maraming salamat po, Doc Jan and Doc Liave. Para naman po sa ating mga kababayan, lagi po ninyong tatandaan, na naririto ang Kagawaran ng Kalusugan upang maghatid sa inyo ng serbisyong pangkalusugan para sa cancer. Nariyan rin po ang ating mga screening tests at bakunahan laban sa virus. Nariyan po ang HPV vaccines upang maiwasan ang cervical cancer. Ang cervical cancer ay maiiwasan at magagamot kaya magpakonsul tayo sa ating mga primary at healthcare centers. So muli po mula noon hanggang ngayon nagpapasalamat po tayo sa ating mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tama at napapanahong impormasyong pangkalusugan. Muli po, isang Juana mula sa Kagawaran ng Kalusugan. Ako si Nikki Nesasario at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po Doc Liaven, Doc Jan at sama-sama po tayo sa isang Healthy Pilipinas.